The title of the next keynote is really interesting, and by way of a general comment, ladies and gentlemen, I'm sure you will all agree that our keynote guests, I think the startup founders can envy their ability to squeeze all they want to say in a short period of time. Now we want to talk about the unreasonable effectiveness of generative AI in healthcare. Here to talk about it, we have Alexandre Lebrun, co-founder and CEO at Nabla. Hello.
Thank you. Hello.
The timer is up. Ready?
Ready.
Enjoy.
Thank you. So my name is Alexandre Lebrun. I'm French, as you can hear, unfortunately. So I have had several AI startups for the last 20 years. Actually fell in love with a chatbot called Sibel. You can see her here. 20 years ago, and then I spent all my life building bots. My second startup was acquired by Facebook, so I spent 4 years with Facebook AI research, where we worked on many models that were before LLMs, but that would become later things like LLM. So I'm sure even your grandmother is talking about generative AI. In this kind of very, very big hype, it's very interesting to redefine what it is. My definition for generative AI is you are creating data from data. Whereas with the old AI, we were turning data, like a picture, into structure, like a word. Is this a cat? Yes or no? This is structured. Generative AI was the next step where you don't care about structure that much. You don't recreate other, like new data from existing data, and we get all the things like that. It's very powerful. It's very impressive. And you can create, well, you can attempt or pretend to create almost everything, even yourself. So you have things like replica, where you just create yourself and see how it evolves. And so imagination is a limit, and people try everything. So of course, it was a matter of months before people tried to create a doctor with generative AI. And we've tried it in my company. So in 2020, October, just before GPT-3 became available, we tried to train a GPT-3 doctor with AI. And for the first 5 minutes, it was doing really well. Very impressive. It looks like a real doctor giving good advice. And then suddenly, after 5 minutes, it advised the patient to kill themselves. And of course, it's a huge black box, GPT-3. Why did he say that? Do you have any control, any way to correct that? No, it's not a code problem. It's just a black box. So then we realized, okay, it's too early. It's so bad. We knew it was a bad idea, but we wanted to try it anyway. But it shows how tempting it can be to build things with generative AI because it looks good. It's very confident. It's very quick initially, but then you run into this kind of wall. So I tend to think about generative AI, and especially text-based generative AI like ChatGPT, as just autocomplete. It's a huge autocomplete on steroids. But don't forget that it's just an autocomplete. It is trained as an autocomplete, and you start some text, and it will produce a sequence of words that looks like probable if you start with this text. And it's nothing more. It's very powerful, but it's nothing more than that. It's a bit like the autocomplete you get in Google or in Gmail when you write, and this is it. And so, of course, I don't think anybody would trust put their health into the hands of an autocomplete. And yet, some people are trying to use this to build AI doctors. So, yet, I think we shouldn't throw everything with LLMs. And in some aspects, it has been proven by many studies that, for instance, ChatGPT, which is the Rolls-Royce of generative AI for text, is better than doctors, not for everything, but for some things, like, for instance, empathy. In many studies, the people score the answer of a doctor versus the answer of ChatGPT. They don't know which one is which, and ChatGPT is really stronger. And so, for instance, in this study, a patient had some bleach in the eye, and he was worried that he may become blind. And ChatGPT produced a very long answer with lots of information, very reassuring, very detailed, and the patient was very happy. The doctor, on the other hand, just said, I think you'll be fine, and he left. And so you can see why having a lot of time, like ChatGPT, a lot of information, and a lot of previous patterns can help you be very good in empathy. And as you know, doctors, I mean, some of them are very empathetic, but they don't have maybe the time, and empathy may be a question of time. And so we can understand why it works well there. So the question, what I'm saying is not we shouldn't really use generative AI for healthcare. So my conclusion is we should use it for some aspects of it, and especially to empower physicians instead of trying to replace them. And I'm just saying the same thing as my friend from the previous presentation. We know that doctors spend at least 50%, I think you said more, of their time spent on clerical tasks, on admin stuff, filling forms, doing these kind of things. And we should really use generative AI first to do that before we can earn that trust and maybe do more. And so this is an example, and it's very, very close to what you do at Autoscriber. So it's a good, another example of using generative AI to listen to a consultation, get the transcript, and then from there, generate not only the clinical documentation, fill the EHR, so electronic health record, write some referral letters to other physicians, maybe follow up with the patient. You know, there are so many things you can do very effectively with generative AI after a consultation, and without trying to just be the doctor and take the place of the doctor. So this is, I think, where we should focus our efforts as we are trying to apply generative AI to healthcare. And it's funny to look back in the history of AI. I don't know if you are aware of that, but in the 60s, when the term AI was coined, after a few years, I realized that some people thought it meant artificial intelligence, and some scientists thought it meant augmented intelligence. So there was a quiproquo on the meaning of this acronym, AI. And I think to this day, we still have these two very different orthogonal vision of what should be AI. Are you trying to augment someone, or are you trying to replace them? For instance, for a car, a GPS is really augmentation. You want to help the driver to be more safer, more efficient, and so on. Or you make an autonomous vehicle, in which case you just replace the driver. It's a totally different approach. And what I'm saying today is we shouldn't use LLMs or generative AI today to replace doctor. We should use that to augment them. That being said, I'm not saying either that we shouldn't try to do AI doctors. You know, this is a level 5 of automation. This is similar to what we use for autonomous vehicles, but for healthcare. And I think it may be useful to try to go there to like a Star Trek-like fully autonomous doctor. Maybe not on all markets, maybe not for all illnesses or kind of patients, but in some situations, people today, in some geographies, they have no access to healthcare at all. So why not try to do that? So I think we should still aim at going there, but I don't think LLMs are the solution for that. And there are other attempts to build novel kind of neural networks that I think will be more relevant to that. So I think the best attempt is from Yann LeCun. And so he was my boss at Facebook, so of course I mentioned him, but and I encourage you to read this paper or a summary of it. It's a fully different approach that doesn't rely at all on generative AI. It really relies on different kind of mathematics. And I think the solution to go to autonomous healthcare will come from this kind of research. And it may take 2, 3, 4 years before we get something that we can actually apply. This paper is still at the theoretical stage. No code has been written yet to implement it, but I think this is something we should follow very closely. And so to summarize and to conclude, the title of my speech was The Unreasonable Effectiveness of Generative AI in Healthcare. It was, of course, a reference for those who know to this paper from Karpathy in 2015. Who was like, he's the father of generative AI. He's very discreet, but he's the actual father of generative AI. And already 8 years ago, he was saying, okay, it's why unreasonable? Because on one hand, it's extremely powerful, but on the other hand, if you just try to use it without knowing what you do, it may be very dangerous. So this is a double meaning of this unreasonable word. Thank you very much.
Thank you very much, Alexandre, for a very humorous, positive presentation. Ahead of our next panel, I'm sure we have questions, even though only 8 seconds left. One question, please. Anyone? Do you have one? No, we don't. Self-explanatory again. Thank you.
Thanks.
Thank you, Alexandre.